Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. You know, alcohol-related problems are among the most significant public health issues in the United States, and some people may have found they've increased alcohol use this year due to the holidays or maybe some stressors from the impact of COVID-19. Well, Dr. George Koob, director of the National Institute on Alcohol Abuse and Alcoholism, and a world-renowned expert on how alcohol affects health, is joining us here on Health Professional Radio to talk about Dry January, recognizing signs of alcohol problems and ways to get help. Welcome, Dr. Koob. Thank you for joining us.
Thank you. It's great to be with you.
Well, Dr. Koob, what are some possible signs of an alcohol-related problem that may have surfaced during the holidays? And if you think a friend or maybe a family member may have a problem, what are some things that you can do to possibly get some help?
So if you discover your people are uncomfortable with your drinking, or you're making people uncomfortable with your drinking, that's a very early sign that maybe there's a problem looming. And then if you expand that to what I call impairment in social and occupational functioning, which, you know, another way of putting it is problems with interpersonal relationship, problems at work, getting work done on time, getting to work on time, meeting deadlines, or you know, basically break down in other responsibilities. All of those things are, if they're linked to alcohol, are pointing to a potential problem.
Now, the COVID-19 pandemic has increased many people's, time at home. Some people may possibly be dealing with depression and possibly some anxiety about losing loved ones, illnesses, of course, lost jobs, maybe career changes or some other stressors. What have experts observed about the impact of this COVID-19 pandemic on drinking rates and health overall?
Well, as you point out, the pandemic has been very stressful, and one of the biggest stressors involved is our loss of interaction with our fellow human beings. And we are primates, after all, and our biggest reward in the world is another primate. And so it really has contributed to the stress that we've associated with this period in our history. And, you know, about a third of individuals in the United States have been drinking more during the pandemic, and many of them to cope with stress. And that's a slippery slope, because once you start, alcohol will reduce stress temporarily for a few hours, but when the alcohol wears off, the stress returns in a vengeance, and all those feelings of loneliness and isolation and negative emotional states all come back and are worse than before. And so you end up, using alcohol to fix the problem that alcohol's causing or making worse. And so, I think recognizing that is a first step in trying to help people, that maybe there should be alternatives to drinking to cope with stress.
Can taking part in Dry January, that's not drinking any alcohol during the month of January, be a healthy step to take?
Yeah, we believe so. I mean, we think that at a minimum, when you participate in Dry January or something like it, could be Dry October, you have the opportunity to evaluate your relationship with alcohol. And if you feel better when you're not drinking, to put it quite simply, your body's trying to tell you something, and you need to listen to your body. I mean, if you're sleeping better, if your interpersonal relationships are getting better, if you're getting re-energized at work, and because you're not drinking, you need to pay attention to that.
That makes a lot of sense. Well said, Doctor. Give us a website or two, or where we can go to get some more information, if you would. So
there are two websites, Rethinking Drinking, which discusses many of the issues we've raised. It's called rethinkingdrinking.niaaa.nih.gov. And then there's what we call the Treatment Navigator, and that's alcoholtreatment.niaaa.nih.gov, which tells you what is an alcohol use disorder as a spectrum disorder, and the spectrum of treatments that are available depending on the severity of the alcohol use disorder. But also you can type in your zip code and actually find a treatment facility in your locale. And to be very simple about this, if you just type in NIAAA in your search engine, you're going to probably get to these websites.
Well, Doctor, I thank you for your time joining us here on Health Professional Radio. It's been a pleasure speaking with you. Thank you so much.
You're most welcome. It was a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. George Koob. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.